Dr Truitt, I know you've been using invisible positioners since their inception. Can you provide us with some insight into your technique?
I'd be very happy to. Basically, the successful use of clear aligners or positioners lies in correct diagnosis. One has to make a differential diagnosis between dental versus skeletal midline deviations, dental versus skeletal class 2s, dental closed bites where instead of the lower incisors being over-erupted, it's actually an underdevelopment of posterior facial height. Once the doctor is capable of making these different differential diagnoses correctly, then it becomes a pretty simple matter for the positioners to align the teeth accordingly.
Since clear positioners only move the teeth, how does Smile TRU differ from other techniques using clear aligners?
Well, we allow the doctor to pre-treat the patient using such things as RN sagittals, ALFs, and to screen the patient for pre-existing temporomandibular joint dysfunction. It's very important that you use the aligners basically as an orthodontic appliance, not as an orthopedic appliance, and to be sure the patient has healthy temporomandibular joints.
So many patients now only want their front teeth straight. How does Smile TRU deal with these cases?
Well, Smile TRU is quite unique in that it gives the doctor and the patient a number of options. Some cases can be as simplistic as aligning the 6 anterior teeth upper, and sometimes just one arch where it's upper and not lower, or vice versa. So Smile TRU is divided into different levels of therapy. Level 1 treats the anterior segment, upper and or lower. Level 2 treats through the second bicuspids, and usually these are both upper and lower. And the advantage of a level 2 over a level 1 is if the case requires interproximal reduction, you can distribute that reduction over 10 teeth as opposed to just 6 front teeth. So there is a big advantage there in many cases. Beyond that, we have a level 3 where the case can be treated completely, all the teeth moved, but there's no pre-treatment required. And then the level 3 that requires the pre-treatment, so that's what we call a level 4. We pre-treat it and then it treats like a level 3. So for example, if the patient has narrow arches, we pre-treat it as a Smile TRU complete, and we get the arches developed, and then we finish the case in a standard Smile TRU. So basically, Smile TRU offers 4 different levels of therapy, and when we pre-treat it, we call that level Smile TRU complete.
So how does a doctor or patient learn more about the Smile TRU transparent positioner system?
Well, actually, we have 3 levels of certification. There's the basic level 1, that's a 1-day seminar that goes through the basics of placing attachments and sequencing the positioners and some of the basic pre-treatments like simple arch development cases. We have the Smile TRU level 2, which goes into things like temporomandibular joint dysfunction and how to make splints prior to using the Smile TRU. And then we do Smile TRU where we have 3-day courses that just goes into an extremely advanced situation such as tripoding a case with Smile TRU, translating mandibles with Smile TRU, that type of thing. So the doctor can choose what level he wishes to enter and how fast he wishes to progress through the system. Then we offer these seminars on a worldwide basis in the United Kingdom, South Africa, Australia, Asia, and of course the United States and Canada. So if the doctor is interested in more information, he can just simply get on the website at www.smiletru.com.
Well, thank you very much, Dr Truitt, for that insight into the Smile TRU clear positioner system.
It's been my pleasure. I look forward to seeing you at one of the upcoming seminars.